Hi, I'm Ashley Mazurek, part of the CHEK faculty. Welcome back to the CHEK blog. Today we're going to talk about doctor movement from the perspective of SI joint issues, SI joint dysfunction, or pain in that area. So when somebody comes in and talks about a pain back on the posterior side of the pelvis where the sacrum is, okay? And what that looks like is if we take our little pelvis here, this area right here where the sacrum and the ilium attach, that's where we're going to focus as our SI joint issue. Okay, now lots of things can cause SI joint dysfunction, but what we're going to cover today specifically is a pelvic flexion disorder. So we're going to look at this qualitatively. We don't have the ability to take our tools and measurement this unless you're going to see a practitioner, and a CHEK exercise coach and on up can measure this for you and tell you which side and how much of the ilium is too far flexed and the other side maybe too far extended. Now, in a normal person, we want this pelvis to be flexed for a woman 4 to 7 degrees and for a man 3 to 5. Okay, so when we get an issue like this, what I want to focus today is something much easier, and that's just the muscles that can pull this pelvis on the right side too far forward anteriorly or flexed on this right side. Okay, so if we're looking at the muscles that can do that, we're going to reference the rec fem, we're going to reference the TFL, and the sartorius that attach here at this ASIS and can contribute to pulling it too far forward. Now there are lots of other things that can cause this. I'm just talking about one of those things. And so, if you look at the posterior side of the pelvis, when somebody has that issue, if you can see that, you're also going to see, they're going to tell you that there's a tightness in the sacrotuberous ligament, and they always feel like they've got this tightness. Now, what I've seen in my practice and my experience, the side that they say that they are feeling tightness is usually the taut side, is usually the lengthened side over here, and they've been stretching and stretching and stretching, but unfortunately that's not the side that has the problem. It's not the tight side, and that's why they may not be getting better. Now, it's always important to remember that if you haven't gotten out of pain or it's not subsiding and getting better, then you haven't found the root cause. And like I said, there's lots of root causes for this. It could be a collapsed arch. It could be a sublux atlas. It could be cranial trauma. It could be a distended abdominals or weak transverse abdominis. It could be a lack of a breathing pattern. It could be lots of things. So in order to look at one idea, one function of creating this, we're going to do a simple, just a stretch that can help this pelvis move posteriorly, and that we're going to do a quad stretch. So it's what I'm going to do, and put this down. I want you to follow me over here to the ground, and this particular quad stretch that I love to do that really helps this is we're going to put this knee down on the floor with the side that's too far flexed. Okay, so if we put that knee on the ground in 90 degrees from the opposite knee, we're going to make sure that the pelvis is rotated back or extended. And how we're going to do that is we're going to squeeze that right glute. When you squeeze that glute, it's going to create an extension, okay? It's going to lengthen this hip flexor, and it's going to pull on that quad. And you're going to feel it if it's overly tight, okay? You're going to hinge, or you're going to fall forward and open up this pelvis, posterior rotate that pelvis by squeezing that glute, and then bring it back so that the glute touches the heel. And now hold that stretch for 30 seconds or more to let it release. Okay? Now, one of the things that we're going to identify with understanding if we do have a pelvic flexion disorder, I'm going to give you a little tip here. If you take your fingers and you go to this ASIS and you put them on there, you should see it level. But when you've got a pelvic flexion disorder, one side is going to be lower than the other. Okay, and that's going to tell you the side that's more inferior, that's the side that you need to stretch. And we're going to stretch the muscles that have the most amount of pull on that pelvis, and it's the rec fem, the TFL, well, and the sartorius. Now, I want to address another aspect of getting dysfunction in this area, and we have to dive into what has much more of an influence, and that is the mental, emotional, and spiritual. Now, unless you have trauma to the physical body, and that manifests the pain, we can go with that being the root cause. But another root cause could be the mental, emotional. So mentally, emotionally, what's going on with the individual? And if we look at the root chakra, could be the second chakra too. If we look at issues of financial, if we look at issues of tribal association, what's going on in the family, the stress with the family, if we look at trust issues, okay, if we get higher up in the second chakra, we're looking at the rhythms. How is their life? Is it too busy? Are they not getting enough rest, and they're not getting enough maybe water in their diet too? That's helping balance them out and bringing more sustenance too. So quality of food can also contribute to this dysfunction. So what I want you to think about is other areas besides just the physical that can be causing this issue or this dysfunction or this acute or chronic pain. Last is spiritual. Identifying whether a person is truly being authentic and taking responsibility for what they've created in this lifetime. So that's a holistic integrated approach. We as CHEK practitioners, that's what we do. That's a part of getting to the root cause. It's not just about the physical. We've got to address all the other issues if we truly want to get somebody out of their dysfunction. I thank you for taking the time to watch this video, and welcome back. Next time we're going to talk a little bit more about contributing to that influence of overflexion of the pelvis by looking at the lumbar and the psoas and how it takes place in doing in that, and we'll go more further into to back pain. Have a great day. Thanks a lot.